Hello and welcome to another edition of Currently in Quincy. I'm Joe Catalano, and on today's program, we'll chat with Kevin Reno of the Social Security Administration for an update. First, though, we check out the news for you. Currently in Quincy, there were 21 active cases of coronavirus in Quincy as of Friday, with over 1,300 recoveries. The death toll of 135 has remained unchanged for over a month. Early voting continues in Quincy this week. Ahead of next Tuesday's state primary, voters were able to cast their ballots this past weekend at North Quincy High School. And now this week, early voting taking place in the Great Hall at Quincy City Hall from 8:30 a.m. to 4:30 p.m. through Friday. City Clerk Nicole Crispo says there will be tabulating of the early and mail-in votes before the election. However, she says the results might not be available until the day after the election or even later.
Ongoing tally throughout the phases of early voting until election night.
Oh, all right.
But if we try to put through, say 25,000 people vote, we can't get all those ballots through one machine on election day.
Gotcha.
So
you have to do it earlier.
We need a mechanism to get them so that we can have the election results as soon as we can.
Right.
But and we're going to. We did it last time. We had the central tabulation here at City Hall,
right. Yeah.
So that the early votes didn't go out to the polling place. Mm-hmm. We'll do the same thing.
Okay.
We're going to have this high-speed counter that scans all the ballots, and we'll have that available here to us.
Now, voters are asked to wear a face covering and observe social distancing. Voters should bring a blue or black pen if they don't want to use the one provided, and a clipboard if they don't want to use the voting booth. Each booth will be cleaned after each use, and hand sanitizer will be provided. Mail-in ballot requests must be made by this Wednesday, and the mail-in ballots must be returned to City Hall by next Tuesday at 8 p.m., and absentee ballots are available at City Hall until Monday at noontime. Crispo is predicting a 30 to 35% turnout at next Tuesday's primary. Preparations continue to welcome some students back to school next month in Quincy. School committee recently voted a hybrid learning model that has pre-kindergarten through third graders, along with some high-needs learners in classrooms 2 days per week. The remainder of students learning remotely. Mayor Thomas Koch says every effort is being made to ensure the safety of students, teachers, and staff.
I've got a lot of emails and folks calling, reaching out about the whole issue of reopening. I know some people want to stay home, do remote, some people want fully in person, and there's those that would like the hybrid. And we're working on this really every day. We have voted to send a plan into the state, which includes an opening for pre-K to third grade on hybrid. High need students would be in person, and then subsequent weeks we would then work everybody in hybrid. We're watching the numbers, we're following the data. Additionally, we are preparing every school with updates to the ventilation systems, to our HVAC, PPEs, making sure everything is ready, social distance. There's a lot to it, and I know that some people are very frustrated, no more frustrated than I am. I'd like to get the schools and his kids back in the schools as quickly as we possibly can. So stay tuned, there'll be more coming about that.
Koch says full remote learning will be offered for any parents not comfortable sending their students into classrooms, and that the plan is flexible based on the status of the pandemic. First day of school in Quincy is Wednesday, September 16th, which will be a fully remote learning day for all students. Quincy Mayor Thomas Koch says he wants to select a contractor to build a new public safety complex this year. Mayor says he'll pick a contractor that will also design that new facility, a process that needs state approval. The new building will replace the existing police station on C Street and serve as headquarters for the police department, the fire department administration, and emergency management. The city is taking the Stop and Shop gas station, the former Bryant Post, Father Bill's Homeless Shelter, and Quincy Animal Shelter to make room for the new building and a new parking garage. Father Bill's will move across Broad Street. The animal shelter will relocate to the new dog park on Quarry Street. The City Council approved $32 million for the land takings, but has yet to approve full funding for the project. This year's virtual Food Fest and auction to benefit Father Bill's and Mainspring homeless shelters of Quincy and Brockton is being called a huge success. For the month of July, donors contributed more than $1.15 million, more than doubling their goal of $500,000. The Campaign for Hope, as it was called, featured an online auction, meals packages that benefited local restaurants, and 2 anonymous donors in Hingham that matched $100,000 gifts. Father Bill says it's spending an additional $300,000 per month to cover the costs associated with the pandemic. Coming up, we will check in with Kevin Reno of Social Security. Checking back in with Kevin Reno of the Social Security Administration for an update, although be it virtually. Kevin, nice to see you again.
Thank you very much. Thank you for having me.
It's our pleasure. We're glad to be able to do this and bring folks kind of up to date on what's happening with the Social Security Administration. And we always did this in August because it is the anniversary month, right, for Social Security, the 85th this year?
Correct. 85 years young. That would be us. Yep.
Yeah.
Social Security, yeah.
Any special events happening because of that?
Well, under normal circumstances, usually there would be. This year, with the pandemic going on, not so much. So it's regular. It's business as usual with regards to Social Security. In the past, we've done all sorts of, media blitz, social media outreach during Social Security Awareness Month. And this year, with everything going on, we're just focusing on our primary mission. So not too much as far as the anniversary, other than, again, happy 85 years Social Security.
Sure.
So it's a good, nice birthday to have.
Yeah, exactly. I should ask you, I guess, how is the administration, coping during the pandemic? What are you able to do? What services are you providing, and what can't you do?
Sure. We're coping. We have a number of missions, but our 2 primary missions, the first thing is to make sure our checks are getting out. And I'm happy to report on that front. There's really no impact due to the pandemic. Our checks are coming out on time to the right people, and really no impact there. The other thing is to process claims, to make it possible for people to apply for benefits. And then on our end to actually go ahead and process those applications. And again, I'm happy to report, by and large, that process is still running fairly smoothly. There is one very important distinction in the post-COVID world. Our brick and mortar locations aren't open to visitors at this time. And, that's just because of the transmission of the way that the COVID transmits. It's just not safe for our employees or members of the public to be in our spaces. So with the exception of some very dire need instances, we're closed to the public for the time being. Now, that being said, those same employees are working remotely. They're, instead of being there in the local office to sit down and talk with you, they're manning their phones. It's like a PBS pledge drive. The operators are standing by waiting for your call. So we're still very much working. It's just that kind of in-person element has kind of been removed from the table for the time being.
Sure, which is the case in a lot of instances, certainly. Yeah. So in that the case, what can't be done with Social Security right now?
By and large, most things can still be done. Like I said, checks are still being processed. We're still doing applications for individuals. One of the key things right now is, for instance, in the old world, pre-COVID, if you had a hearing, if you were in the appeals process and you had a hearing, that could be done in person. Now, for the time being, the hearings cannot be done in person, again, just because of the nature of the virus. But we're offering alternative methods, phone hearings for individuals who are in that process. And what I would say is if an individual has a hearing and they're not comfortable doing it over the phone, we're allowing them to postpone the hearing until we get closer to normal. Or have maybe some other options that they could do. So that's certainly one thing that's a little different. And again, we're just not open to the public. One of the things we have found is, luckily for us, prior to the pandemic, we had a pretty robust infrastructure online and over the phone already. A website, socialsecurity.gov, which was already set up to be able to take your application online, or for you to check or change things regarding your benefits if you had them. So we already had that infrastructure in place. So when the pandemic kind of rolled around and we found ourselves in this new operating model, we were already able to just rely upon that as it is. And it's an amazing resource, and it's really where we're kind of directing people to now as the primary source of information for us. And we're doing all sorts of, as it has become apparent that, things have changed, we've tried to the best of our ability to ramp up that site. You can now do things like prior to the pandemic, if you were enrolling in a Medicare Part B special enrollment, so that's post 65, you didn't take your Medicare Part B, but let's say now you're 66, 67. To come in and apply for the special enrollment, it had to be done in person. Couldn't be done over the phone.
Okay.
Now it can be done online.
Oh, all
on the
right.
website. You can now, the paperwork can be submitted in electronically, and the application can be filed right there on the website. And so we're innovating and adapting just like everybody else is because of this pandemic. But other than that, I mean, things are, as I said, by and large, running as they've historically run for us.
Yeah. Do you recommend folks schedule an appointment, a phone appointment?
If you wanted to apply for benefits, absolutely.
Okay.
And we would have recommended that, even if you could go into the office. And there's
Yes.
two ways you can schedule an appointment. We have our national 800 number, 800-772-1213. You can call that and they can help you schedule an appointment, or you can contact your local office. And as I said, the staff is still working and waiting for your phone calls. You can locate the number to your local office by calling, by going to the website, again, socialsecurity.gov. Right there on that main page, we have an office locator, which will allow you to just put in your zip code and tell you what the phone number is to your local office. And then you can call them, and they'll be more than happy to schedule you an appointment.
Okay. And there's an office right here in Quincy, I know, right in downtown Quincy.
There is, right there in Quincy, absolutely. So, and then, like I said, the last thing is if you're so inclined, you can file an application online. Retirement, disability, Medicare, it's all on the website.
Very good.
So, very useful there.
Have you heard, Kevin, of any scams related to Social Security when it comes to this COVID-19 pandemic at all?
Unfortunately, yes. And, we had scams even before the pandemic. Unfortunately, people will take advantage of any and all situations. So we have had a few scams, not just ourselves, other organizations, other government agencies, the Department of Treasury, the IRS, HHS, which is Health and Human Services. They have all reported scams. We have instances in which individuals are calling up. This is more on the HHS side of the equation, where they're calling up and offering Medicare recipients expedited Medicare testing or things of that nature. And they ask the person to give them some of their personal information. And, again, that's kind of where they get people, because it seems legitimate. And then you give them your personal information, and it's certainly out there. What people want to be on the lookout for is anyone calling, posing as a government employee, and offering COVID-19 related grants, economic impact payments in exchange for personal financial information, asking for an advanced fee, a charge of any kind. And again, I think the last time we spoke, I had mentioned gift cards.
Yes.
Social Security, IRS, Department of Treasury, Health and Human Services, Medicare. We don't want gift cards. We have no use for them on a professional level. So it wouldn't be something we would ever ask for. And from the Social Security standpoint, we're never going to suspend your Social Security number. It's your number. It's your number for forever. So we certainly would never, if anyone calls and says, hey, listen, I'm going to suspend your Social Security number, that's just not going to happen.
Okay.
So the best advice I can give an individual is, if they think they have a scam call, just hang up.
Sure.
Just disengage. Don't give them any information. And then if you want to report it, you can call us, again, at the varying methods we just mentioned, or at oig.ssa.gov. That's the Office of the Inspector General. And right there on their page, they have a link for reporting a fraud case.
Okay.
So you can certainly go there and report it through that. Or like I said, just give us a call.
Sure. Very good. It's good to know, because really, when it comes down to it, Social Security already has all your personal information, right?
We do. And that's not to say that we won't call you.
Yeah.
We will. And, what's unfortunate is when we call an individual, we have to verify that the person who picked up the phone is the person we're trying to reach out to. So we are actually going to ask you some questions about you, some personal questions, that only you're going to know. So it will come off as if we don't know. We do know, we're just verifying it.
Yep.
And what I can say to that point is 9 times out of 10, we're going to call you because of something that was initiated. So it shouldn't necessarily come out of the blue. If you have any questions, if it seems odd, just let the representative know, hey, listen, I'd like to call you back. I don't necessarily know if the call is on the level. Is that okay? And that's more than fine. We get that a lot. You can look up our office numbers on the office locator on the website, socialsecurity.gov, and just call right back. Call the office's main number, and then we'll help you from there. But we will call and ask for some of your personal information. And, the other thing with scams is, I say watch out for fees or charges. There are some instances in which an individual could actually owe Social Security some money back. But we're never going to ask for it up front. And just like everything else kind of associated with government, there's going to be a paper trail. There's due process. We have to notify you that you owe us money back first and give you the right to appeal that.
Okay.
We're not just going to say, hey, listen, we're going to shut off your benefit if you don't give us X amount of dollars by tomorrow. No, you have due process. You have the right to appeal that and to get more information about it.
Okay.
So, that's just some things to look out for, sir.
No, that's great advice. Yeah, because especially for older folks who are maybe a little leery and also a little hesitant to hang up on a scammer. I think it's comforting to know that they're able to just initiate the call themselves if they want, and ensure that it is legitimate.
Absolutely. Yeah. No. Absolutely. Yeah.
Is there any concern or talk within the administration right now, Kevin, about the recent action to suspend payroll taxes, which does fund Social Security and Medicare?
That's a great question. Unfortunately, the memo or the executive order was just signed, I think, either Friday or Monday. I haven't actually had a chance to really parse it myself, so I wouldn't be comfortable in speaking to that order. It hasn't really, that starts up here, and then it works its way down to me. So kind of the ins and outs of that order, I don't know, and I wouldn't be comfortable on commenting on yet. What I can just say for your viewers is that what you're discussing is for anyone who gets a paycheck, by and large, you pay into Social Security, and you pay into Social Security via taxes, FICA or SECA if you're self-employed. For Social Security, there's a 6.2% tax taken out. And for Medicare, it's 1.4%, and your employer will match those. And so that's what being discussed in this executive order is 7.6% Social Security and Medicare tax being taken out of individuals' paychecks.
Right.
So that's just for some general knowledge. But the implementation of the order, it's a great question, but I don't have much specific yet.
Okay. All right. Yeah.
But excellent question. Yeah.
It just the first thing that dawned on me was, that's where the money comes from. So
it is. Yes. And that 7.4%, when it's taken out of your paycheck, it goes into the Social Security Trust Fund. Again, just for kind of some background on what that is. And that's how we fund what we pay to individuals. So yeah.
Sure.
But no, I don't have any specifics on how that's going to look going forward.
Okay. Any special considerations for veterans or spouses, families of veterans when applying for benefits?
For a veteran applying for benefits, there are certain categories in which, based on their disability, if they're applying for Social Security disability or SSI, which is the other form of disability we have, it's certainly something that we will look into and used with regards to making our medical determination. For spouses and children, not necessarily. Really what gets you a spousal benefit or a children's benefit is the fact that you have a spouse or a parent who's entitled to a Social Security or retirement benefit. At that point, we don't necessarily parse, well, was this person a veteran or weren't they? What we're just looking at is, are they entitled to a benefit? And is that one of the benefits that has these subsequent benefits? So for instance, retirement offers spousal benefits, divorce spousal benefits, widows and widowers benefits. Disability, Social Security disability insurance offers the same. SSI, which is Supplemental Security Income, which is an income and resource-based disability program, also age-based. So if you're 65 or older and have below a certain income and resource level, that does not have any additional benefits, no spousal benefit, no children's benefit, nothing like that. So it's not so much a veteran or not, it's are you entitled to a benefit, and does that benefit have the accompanying auxiliary benefits with it?
Sure. Okay. Will the unemployment and also the additional government stimulus payments that have been made to folks affect their benefits in the future?
It's a great question. It depends is
Okay.
the answer. And it depends on what kind of benefit you're receiving. So if you're getting retirement or Social Security disability insurance, no, because the unemployment benefits or really any other type of federal benefit is considered, or state benefit is considered unearned income. It's not income generated via work.
Okay.
So for those benefits, no, the unemployment benefit has zero impact. However, I will say this, if you're getting the unemployment benefit, the Social Security benefit may impact the unemployment.
Oh, okay.
And so if you're getting the unemployment, I would say you would definitely want to let the unemployment office know, hey, listen, I get Social Security disability insurance, or I get retirement. And they may say, okay, well, we have to offset your benefit by the amount. If you're getting SSI, supplemental security income, which is, like I said, an income and resource-based program, yes, the unemployment or really any other aid income, whether it's unearned or earned, does impact the benefit.
Okay.
And yeah, so it depends on what kind of benefit you get.
It's good to know because folks might find themselves owing, after the paperwork
Right.
caught up. So, yeah.
Yeah, and for us, we do get notified eventually.
Sure.
But really, if you've ever read any of our applications, the responsibility to notify us falls to the individual.
Yes. Yeah.
And, if you go months and months and months without telling us, and then eventually the state notifies us, you will end up with an overpayment like we discussed. And those are never pleasant.
Yeah, exactly.
So, if you're on SSI, just understand really any income or resource that comes into the household needs to be reported.
Okay. Yeah. Personal responsibility. And then,
Yeah.
and then this COVID world that we're in, everything is taking a little bit longer too. So,
Yeah. Yeah. Well, I mean, we're doing pretty good on keeping up. Like I said, although the offices aren't staffed right now, we still have people going there. So we're still processing mail about the same level that we did before. And, so we're managing to stay pretty much on par with where we were workload wise prior to COVID-19. It's just, we're just not in our normal, as you can see, we're not in our normal duty locations. So,
right. Can folks actually get a replacement card, Social Security card right now?
They can. So we have a great tool here in Massachusetts. We don't have it in every state yet. We have it in I think 40 or so states, but you can get a replacement Social Security online on the website, socialsecurity.gov. And all you need here in Massachusetts is a form of ID. So either a Mass State ID or a Mass State license. And I just was reading actually before we got on this call that later this month, so as of right now, you have to manually type in all of your license or ID information. They're now going to be building in a platform where you can scan it.
Oh.
And it'll just propagate the information right over to the system to save individuals time.
Okay.
But yes, you can absolutely get it via the website. If you are a beneficiary and you have a My Social Security account, you can actually get a replacement Medicare card on the website as well. Which is useful. You don't need a benefit to get a replacement Social Security card. And then if you can't access the website, you can still call your local office, and we can via the mail work with you to get you that replacement Social Security card.
Okay. And
so that's still rolling right along. Certainly.
Yeah. Is there a cost for that, Kevin?
Never.
No. Okay.
Never. We will never charge for a Social Security card. And if you encounter someone saying that you need to pay for a card, that is incorrect. The whole process is free, start to finish.
Very good. And guard your Social Security card and your Medicare card close to the vest, right?
Yes,
Yeah.
always. Don't put it in your wallet. Don't put it in your purse.
Yeah.
Keep it in a safe location somewhere. You don't want to carry that around with you because if it gets lost, someone has that information. So yeah, most certainly. Good, very, very good point.
I like to always ask if you could review. And this is a question I get all the time from folks that I interact with is, when is the best time to take Social Security benefits?
That's a great question. And there's no one good answer.
Yeah.
Because it really depends on your situation. You can retire as early as age 62. That's the earliest anyone can retire. But if you do, it's going to be reduced. And we have this age, it's called full retirement age, which is when you're going to get 100% of what it is we owe you. Right now, for most people, it's anywhere between 66 and 67.
Mm-hmm.
So if you go out as early as age 62, the benefit is going to be reduced by about 25 to 30%, depending on when your full retirement age is. The other thing to keep in mind is Social Security is only going to replace about 40% of your pre-retirement income. Okay. So, what I often say to people is, okay, you're thinking about retiring. Great. I want you to take your monthly earning right now. I want you to reduce it by 60%. If you could live off of that and all you have is Social Security, then sure, you definitely want to consider retiring right now. But if you couldn't, and you don't have any savings, you don't have any investments, you don't have a 401k or whatever, or a rich uncle who can, get you through this, you might want to hold off on going out at 62. Because for every month you wait, as you get closer to your full retirement age, the benefit goes up. And as you continue to work and contribute into Social Security, we're always recalculating your benefit, and it goes up. Even once you've retired, if you continue to work, we will recalculate your benefit based on that work. So it really depends on the individual's circumstances.
Okay.
What do they have for pensions, 401k, savings, investments? What else are they going to use? What's their cost of living, and what's their cost of living going to be post-retirement?
Yes.
So it's a moving target. I would say, socialsecurity.gov is a great resource for this, and it has two things. You can set up your My Social Security account. And what that's going to give you access to is that's your one-stop shop for your retirement-related information. It tells you what your benefit is at 62. It tells you what your full retirement age is and what your benefit is. And we have a little thing called delayed retirement credits, which is like this bonus of about 8% for every 12 months you go beyond your full retirement age. And it tells you what the maximum of that would be, which is at age 70. It tells you what your spouse can get, divorced spouse can get, your children can get if you were to pass away, what your widow's benefit would be. So it's an amazing site if you're in that kind of pre-planning phase to try to figure out, would it make sense for me to go out at 62? There's also my personal favorite resource we have is our retirement calculator. It's right on our homepage, about middle of the page, right-hand side. And this is a calculator where you just basically give it, I think it's going to ask you for last year's earnings, this year's earnings, and next year's anticipated earnings. And then you pick a date post 62 or even at 62. Let's say you wanted to know what your benefit would be at 65 in 3 months. Well, it's going to tell you.
Wow.
66 in 7 months, it's going to tell you. So it's a great tool for being like, okay, I think I want to retire next year, but I don't know how much my benefit's going to be. You go to the retirement estimator and it tells you, it's going to be $600. You're like, all right, I'm going to retire in 2 more years.
Right. Yep.
So it's an amazing resource. And then, of course, for individuals who aren't comfortable with the internet, which I completely understand, you can give us a call and we can walk you through that over the phone. Again, at your local office or at the 800 number. We're more than happy to give people that information. We'll never tell you when you should retire. That's not our job and our responsibility, but we'll give you all of the information about your retirement period so you can make the most informed decision and pick the right time for you.
Once you do start accepting benefits, can you stop and then start again?
You most certainly can. Well, like with most of our answers, it depends.
Okay.
You can withdraw an application within a year.
Oh, okay.
Now, here's the rub. If you withdraw an application, you pay us back everything that we paid you.
Sure. Yeah.
Okay. The other thing you can do within a year is you can suspend the benefit, which basically is putting a stop on it, but not having to pay us back. And, some reasons why someone might want to do that is, let's say you went out early. Let's say you went out at 63. So you're not at full retirement age yet. And then a couple months into it, you realize, I want to go back to work. Or maybe my Social Security isn't enough. I need a little extra. There's an earnings restriction level for someone in early retirement. It changes year to year. For this year, it's $18,240. Now, if you exceed that number, we're going to reduce your benefit in the next year $1 for every $2 you go over it. So let's say you go over by $10,000. That means next year you owe us $5,000.
Gotcha. Okay.
So what we do is we just don't pay you until you've paid us back. We reroute your check right back to Treasury, and that's that until you've repaid your money. In that instance there, someone might want to suspend and say, hey, listen, I don't feel like paying you back. I do feel like stopping it because I know I'm going to go over this level, and I don't feel like having my, the benefit redirected back to Social Security. You may see that then. The drawback to that is if you have any spousal, a spouse drawing a benefit from you, spouses are eligible for 1/2 of the primary wage earner's benefit, or any children drawing from your benefit. It's basically like a water faucet. As soon as you turn off the tap, anything else that was drawing from that also gets turned off, also gets suspended.
All right.
So you'd have to be aware of that. But yes, you can stop the benefit if you wanted to. What I would say is, if you think that's something you're going to consider, you might have to do, give us a call first, work through the scenario with one of our representatives, and we'll figure out if it really is the best solution for what it is you're going through.
Okay, good,
Yeah.
good. What is the actual benefit based on, Kevin? I've heard it's the past 3 years of your working career. It's the highest 3 earning years. What is the actual basis of it?
It's a great question. I think the highest 3 years is actually how, for the best of my knowledge, it's how I figure out my 401k, but it is not how we figure out your Social Security. We look at a much bigger picture.
Okay.
We're actually going to look at your highest 35 years worth of work.
Wow. Okay.
Yeah. So we look at your highest 35 years worth of work, and we do all sorts of fun little math in the background. And at the end of the day, we get what's considered to be your averaged indexed monthly earnings amount. And then we apply that against 3 other mini equations, and it spits out a benefit amount. But basically, we add up those 35 highest years, and that's how we do it. Now, like I said, let's say you've gone out you've retired. You're 63, you've retired, but you continue, let's make it a little easier. You're at full retirement age. That way we don't have to care about your earnings. But you continue to work.
Yep.
All right. Every year, we're going to look at your new earnings, and we're going to compare that to the 35 years we use to determine your benefit. And if we can switch that year out with one of the lower years, we do.
Oh, all right.
And we pay you a new benefit. So, when you were flipping burgers at McDonald's when you were 18, or delivering papers or whatever it is, people did back then, and now you're doing a job that pays infinitely more, hopefully, we will revert those, and you'll see the benefit increase. It's, it's not usually super, because it's an average,
Yes.
35 years, but it doesn't hurt.
Yeah. So it really is.
As long as you're contributing into the system, into Social Security, again, through the FICA or SECA tax, like we discussed a few moments ago, we'll always recalculate your benefit. Your benefit can never go down. So let's say post full retirement age, you have lower earnings than your historical earnings level. But we'll never reduce a benefit.
Okay.
The 2 things we'll do is we'll either leave it alone, or we'll bump it up.
Okay. Very good. I think we've covered a lot today. Anything else you think is important to touch on right now?
Just to stress to individuals, we are very much open during the pandemic. Although you cannot go into a location unless it's a dire need situation, we are very much open, and you can get in touch with us by our website, socialsecurity.gov, our 800 number, 800-772-1213, or by calling your local office, and our representatives are more than happy to assist you. We have an amazing website. Again, I mentioned it's socialsecurity.gov. On that site, we have a page dedicated just to coronavirus updates relating to Social Security. Okay. So I would definitely say, if you have any questions, we covered a lot today, but we weren't able to cover everything about kind of the agency's response to COVID.
Yes.
But if you have specific questions about, getting help from Social Security, hearings, monthly benefits, anything, you can go to www.ssa.gov//coronavirus. Or you can just go to the homepage, and at the very top of the homepage is a big bright orange bar that says coronavirus updates.
Okay. Great.
So that any updates we have, we're placing there, just the public can see and find out what's going on with the agency during these very unique times.
Yeah. So, what would be considered a dire need situation where somebody would have to go in?
It's a great question. It's really going to be at the discretion of the management official in the office.
Okay.
But probably it's things that just there are certain things that have to be done in person by policy. So anything that kind of would fall under that category would be considered a dire need. What I would probably say is, if you think you're going to fall into that category, again, you're going to want to call, because the first thing that's going to happen is it has to be done by appointment.
Okay.
The office manager is going to have to schedule a time in which the manager and the individual would need to meet.
Yep.
You really can't bring anyone else unless, again, it's been vetted by that office manager. For now, we're requiring masks be worn by both our staff and the person visiting, so it has to cover both your nose and your mouth. If you do not have a mask, we would provide you with one.
Good.
We're asking individuals to do self-screening if they are going to be coming in, checking to see, do you have a cough, sore throat, fever above 100 degrees, muscle pains, any of the kind of COVID symptoms that are out there. And if you do, let us know, and we'll wait until after you've hopefully gotten over it and the 14-day quarantine period has ended.
Yes.
So it's really case-by-case basis,
Okay.
but the takeaway there is just give us a buzz, and we'll figure out, do we absolutely need you to come in, or is this something we can do through some of the other channels that we have at our disposal?
Great. Okay. Jay, really appreciate your time, Kevin. This has been great.
My pleasure.
Yeah. Hopefully next time we can do it in person.
Yes. Hopefully. Yeah. Yeah. The outside world. It'll be nice to get back out there.
Absolutely.
Yeah. So
be well, and happy 85th anniversary to Social
thank you very much.
Security.
Thank you very much. Here's to another 85. All right. Good talking to you.
Bye-bye.
Bye.
Special thanks to Kevin Reno from the Social Security Administration for joining us. Thanks to our crew. Thank you for watching. And a reminder to please participate in the Quincy COVID Memories Project by sending in your photos, your videos, artwork, stories, any other experiences of your life in Quincy during the pandemic. You can upload them to quincyculturalmemory.com or send them to the Thomas Crane Library, Attention Local History, 40 Washington Street, Quincy, 02169. And visit our newly redesigned website at qatv.org. Find our latest programs, news and information, video on demand, information about online classes, live streaming, and much more. For all of us here at Quincy Access Television, I'm Joe Catalano. Please stay safe.